everybody. This is Dr. Jessi Gold. I'm a Washington University psychiatrist at Barnes Jewish Hospital, and I'm coming to you on behalf of the Pandemic Task Force. I'm going to talk to you a bit about mental health today, which obviously is my favorite topic. One of the things that we haven't been talking enough about is our feelings and our emotions, and this experience has been really hard, particularly with the Delta variant coming, and it's something that we should be talking about out loud. We don't ever take time to ask ourselves how we're feeling, and then when we do, we tend to judge those feelings when we have them. But really, what we should do instead is say, okay, I feel sad, okay, I feel angry, okay, I feel upset, and we just deal with that and let that be and not judge those feelings. So especially with the Delta variant and all of the feelings that that's bringing up, I think it's really important to know that any of the feelings that you're having are completely normal, and they don't make you a bad person or a bad mom or a bad doctor or a bad whatever, insert whatever adjective or person that you want to be in that sentence. And I think it's important that we point that out. And then, going back to work and going back to school can also be really anxiety provoking, particularly right now with all of the things that are up in the air, with the way that the vaccine is and the way that the virus is coming in. It's hard to know what it's going to look like when you go back to school. So I think it's important for you to know that, like, having feelings of uncertainty and having anxiety about that is also really normal. And if you feel like that, you don't have to jump right into the deep end, and you can actually do baby steps to do things that are more comfortable, so you don't have to be at work all day every day or go to school all day every day, and try to do some things that are like little steps to get there before you have to go back. Another way to do that is to make sure you take out some of the things that might be stressful leading up to it. So if you have to go back to work and you haven't been there in a while, think about where you have to park and think about what your office looks like and pack your lunch and have all those things done, so it kind of takes out the stress of preparing to go to work or preparing to go to school and lay out your outfits, that sort of thing, because it can definitely take out the planning, which can be really nice. Another thing that you can do is to think about what kind of coping skills can happen and help you in the moment. So sometimes when we're back at work or sometimes we're back at school, you can feel anxious in the moment, or you can feel sad in the moment and not know what to do. It can be really helpful to figure out what works for you in those moments, or what works for you leading up to those moments, and try on different things and see what works and go from there. There are lots of different things you can do, and I'm one of those people who has been told a million times that mindfulness is the best thing that you can possibly do, and there's lots of evidence that suggests it's really good, and I've tried it probably 15 times myself and have a really hard time doing it. So I think it's really important that you figure out what you like, and that could be going for a walk, that could be hanging out with your dog, that could be deep breathing, that could also be mindfulness, and you could just not be me. And that might be a way to go about, trying to figure out what works for you. And lastly, if you're noticing that your anxiety or your worries or your stress or the way that you're feeling or you're feeling sad is starting to affect how much you're sleeping or how much you're eating or how much you're interacting with people, or it's really interacting with your day-to-day life in a way that it's become really hard to deal with, it's really important that at that point you go seek help from a mental health professional, someone like me or a therapist, and at that point they can really help you with that. But I think it's important also to point out that it doesn't really matter. No one's going to say you're not sick enough to be here. No one's going to say you're in the wrong place. I think if you want help and you think it could be useful to talk to someone or useful to ask someone if what you're experiencing is normal, we're always here. And that's one of the things that I really like about mental health, is we have an open door, and it's not something to be ashamed about. Asking for help is a strength, not a weakness. And no matter how many times we don't say that in our society, it's definitely a true thing. So I hope that you know that, and I hope that you're prioritizing yourself as much as possible, and that you have a good rest of the day.